This NHS service is a specialist service designed to meet the needs of cancer survivors who've had breast cancer. As a result of the radiotherapy treatment, some patients may have suffered from brachial plexus injury. Our service aims are to improve function, use of the arm, gain independence, reduce pain and improve quality of life.
As we all know, radiotherapy has transformed the way that we treat cancer, and survival rates are better than they ever have been. However, there are still some people who experience side effects from radiotherapy, particularly those who may have been treated in the past. These symptoms are difficult sometimes to relate back to the radiotherapy, as often they may not occur until 3 to 5 years after treatment, or perhaps as much as 10 to 15 years later. The type of symptoms patients may present to you with are complaining of a neuropathic type pain in the arm adjacent to the treated breast, such as burning, stabbing, pins and needles type sensation. Confusingly, sometimes they can report also a numbness in that limb. They're likely to have lymphedema, may have osteoporosis as seen on X-ray, or indeed some people have lost bone in the treated site, particularly the clavicle. The Breast Radiotherapy Injury Rehabilitation Service has been set up specifically to help these people. It's a nationally commissioned service, so therefore free to all within England. If your area of work is outside of England, then you will need to request local area approval. Feedback from our patients so far has been uniformly positive. They've stressed that we've helped them to manage their pain better, in some cases actually improved the range of movement within their arm.
Sometimes when you self-refer, you might have, like I did, resistance from my GP. He's come around now, but it took some time and some persistence and some help from the hospital. But it's worth doing that because it just makes a lot of difference.
Any healthcare professional can refer directly into the service. The initial contact would be with a specialist nurse, and this nurse would make an appointment with the patient, usually over the telephone, where they would have an hour-long consultation to assess the patient's needs before they come to clinic. Each patient is asked to identify what goals are important to them and what their needs are. The multi-professional team all meet during clinic to talk about each patient and to ensure that their care is coordinated to meet their individual needs.
The treatment was excellent. To have a one-to-one meeting with different specialists and their subject. And I was very surprised to hear that only 20% of my muscles at that time were working. How would I feel if I could have 15 to 20% back? And I said, yes, that's 100%, I'll have it, thank you.
The clinics have experts in the fields of oncology, pain management, respiratory, rheumatology, psychology, and as well as specialist occupational and physiotherapy. Once the patients have attended the clinic, the GP will receive a very detailed clinic summary from each of the clinicians, making recommendations. This may be to do with medication or referrals onwards, maybe to physiotherapy or occupational therapy. Once they've been through clinic, the patient will receive a phone call from a specialist nurse who knows the patient quite well at this point and will ensure that the recommendations are being followed in practice.
I've now got movement in my hand that I didn't have. I feel that it's going to be better.
I'd like to stress that radiotherapy is a highly effective treatment. The Breast Radiotherapy Injury Rehabilitation Service is just for those who have the rare consequences of radiotherapy.